almost 3 million children die every year from causes related to malnutrition. More than 160 million young children are stunted due to malnutrition. A child who gets enough healthy food before turning 3 finishes at least 4 more grades of school and is 33% more likely to escape poverty as an adult. Since March of 2016, World Vision, in partnership with the Global Affairs Canada, have been implementing a nutrition program called Enhancing Nutrition Services to improve maternal and child health ENRICH in Elgeyo-Marakwet County.
World Vision Kenya is a child-focused, community-based humanitarian organization that has been working in Kenya for the past 40 years in marginalized and fragile communities to address poverty as well as injustice. The ENRICH program that we rolled out in World Vision Kenya covered the hard-to-reach environs of Elgeyo-Marakwet County, which has a very high malnutrition burden on children and mothers.
The nutrition levels earlier, before the introduction of the ENRICH project, were not very good. Initially, our stunting levels were at 30% in the whole county. And where the ENRICH project is covering, that is the Hanging Valley, the Lower Valley, and some part of the highlands, the stunting levels by then were around 40%. But when ENRICH project was done, during the midline survey, it showed that the stunting level had improved to about 35%. So that means that the ENRICH project brought change.
In January of 2018, World Vision and the Canadian High Commission officially handed over health supplies and equipment worth 26.4 million Kenya shillings to Elgeyo-Marakwet County Government on behalf of the ENRICH project. The supplies, which included delivery beds, infant warmers and digital blood pressure machines, were distributed to 111 health facilities of different cadres across the county.
In the past, community members were discouraged from visiting some health facilities because they knew even if I visit, they don't have this, they don't have that. But under the ENRICH project, we've been able to support very many health facilities in hard-to-reach areas with medical equipment that is key.
Through the ENRICH project, we have received a lot of equipment. We have the anthropometric measures, what we use to monitor the nutritional status of our children. These include what we call MWAC tapes, it includes the tape measures, it includes weighing scales, which we've received to most of our facilities. We've received incubators for some of our facilities. These equipment have really gone a long way in ensuring that we are able to assess the health status of the community.
ENRICH program takes a comprehensive approach to improve delivery of essential nutrition services like increasing production and consumption of nutritious foods and micronutrient supplements by women of childbearing age, pregnant women, children under 5. In partnership with Nutrition International, Harvest Plus and Kenya Agricultural and Livestock Research Organization (KALRO), the ENRICH program has introduced the production of biofortified crops, specifically orange-fleshed sweet potato (OFSP), which is being multiplied and promoted through lead farmer demo farms and iron-rich beans production.
MNPs contains 15 micronutrients, and the different micronutrients have got different importance in the body. Like for example, if you look at iron makes sure that it boosts the blood in the body, the circulation of blood, and when the blood is sufficient in the body, the development of the child will be okay. The orange flesh sweet potato is also very important because it is rich with vitamin A, it is very rich with energy, it is very rich with carbohydrates. And when you look at the iron-rich beans, it has been biofortified with iron. Most of the pregnant and lactating women, when they consume the iron-rich beans, it is going to provide some required micronutrient, which is the iron in the body. Apart from even building the blood stores in the body, it makes the mother to be active. That is why a mother who is not having enough blood stores will feel tired most of the time, will not be able to be productive as compared to the mother who is having enough blood stores.
We were lucky enough because our partner, World Vision, has been here long enough. The county also has been here long enough. So that When we were trying to address those who are supposed to benefit from this program, we already knew those farmers were already in our list. Of course, we were targeting mothers with children under 5 years, so that at least we were able to measure nutritional status from the time we started the project up to the time when we were ending. We have other special group of farmers who are assisting us in the multiplication of beans. So we used to train them. After the training, we give them the seeds, they plant, and then we purchase the seeds directly from them.
Nilivyojihusisha na hii kazi uzaji wa sweet potatoes na nyota beans ilinisaidia sehemu kubwa sana. Nikikombea na mahindi, unapanda mahindi unangojea mpaka mwaka moja. Alafu mwaka moja huwezi kuwa sure kwamba utapata bei ya mahindi na black pea. Lakini hii kitu yenye ilinisaidia kwa hii ilikuwa na market. Kuna wenye wanakuja nunua. So kampuni yenyewe wali source market. Ikifika tu hiyo mwezi 3 wanatujulisha tukate na tunapeana, tunangojea mwezi moja tunapewa pesa. So niliona umuhimu ya hiyo, ilinisaidia kwa watoto, ili tusomeshe watoto ya shule kabisa. Maana ni pesa labda si ati inakuja polepole.
Through training, ENRICH has empowered community health volunteers to conduct household visits, offer counseling, and make hospital referrals. The CHVs reach 31,500 households each month with timely messages on the importance of dietary diversification, antenatal and postnatal care visits, skilled delivery, as well as good hygiene and sanitation practices such as proper use of latrines and hand washing at critical times.
We are glad that with the coming of World Vision, they were able to support the lowlands where we have the community units. They have been supporting 26 community health units within 11 wards. We reach out to these wards through the CHVs. These are community health volunteers who work in villages. And in these villages, they visit the households. That is, every community health volunteer has a village where he has a number of households within that village.
Kwa department yangu kama public health imesaidia sana kwa upanda ya kufacilitate kwa mambo ya supervision na mambo ya kufanya mambo ya evaluation kwa some areas na kufanya mambo ya monitoring. Na pia imesaidia kwa department yangu, wamesaidia kusupply kwa mambo ya hand washing facilities na kupeana pia trainings zenye zinahusiana na mambo ya hand hygiene, especially wakati wa COVID-19. Hata kusupply equipments. Those are just preventive areas. So wamesaidia sana katika sehemu hiyo.
Kazi ya CHV nilianza mwaka wa 2014 na hapo mbeleni tulikuwa na changamoto. Tukimwendea watu wetu kwa kijiji, hapo mbeleni walisema hii ni maneno gani ndio mnakuja kutufunza kila wakati atumtungojee hivi. Lakini kutokea 2015-2014 waliingia kwa laini. Hapo sasa tukapata kuchunga watoto wetu, hasa wakati mama mjamzito alipojichua ako na mimba. Tulimwelezea ya kwamba ni lazima uende clinic immediately after getting the information. Uone status yako na hata mtoto akuwe na afya mzuri.
CGV ni care group volunteer, na vile tulijiunga lead farmers walikuja wakatutafuta, wakatuambia tunataka tukuje tusaidiane ili tukuje tuanze tufunze wamama. So ndio tukaajiriwa siku hiyo 2018, tukafanywa training, alafu tunaenda kufunza hao mama. Niko na women 13, mafunza about pregnancy, breastfeeding, nutrition. Kwa hizo zote tumeona ya kwamba wamama wamejua mpaka saizi kwa vijiji. So hii program imetusaidia kwa umbali sana. Sasa hii mambo ya MNPs tutaendelea nayo. Potatoes zenye tulipewa tutaendelea kulima, tutaendelea kukula vizuri. Beans ambayo tulipewa ENRICH tutaendelea kulima na tutaendelea na maisha.
upande yangu kama mimi jinsi nimeweza kufaidika na CHV, wamekuwa wakitembea nyumba kwa nyumba, na vile wamekuwa wakitembea nyumba kwa nyumba tumepata msaada. Maana wanakufikia, wanakuletea habari ya kwamba vile unastahili kuchunga mtoto. Wanakusaidia kwa hiyo MNPs. Ni poda ambayo unaweka kwa chakula, si moto na si baridi, iko katikati hapo. Unaongeza kwa hiyo chakula, unaikoroga vizuri, alafu unalisha huyu mtoto kwa muda wa nusu saa ili akule hiyo chakula polepole mpaka amalize hiyo chakula. Na nimeona kuna utofauti ya huyu na hawa wengine. Nikaona kumbe hii MNPs imekuwa ikisaidia sana. Juu nimeona yeye amekuwa haraka, anaongea haraka, ameita watoto hao wote majina, ako chonjo, amesikia kila kitu, ako very sharp. Hivyo mimi niseme kwa upande ya CHV nimefaidika sana, maana wamekuwa wa msaada sana.
ENRICH has also championed the establishment of men care groups, community social accountability groups, religious leaders at the ward level who have enhanced community participation in reproductive, maternal, newborn, child, adolescent health and nutrition, and their demand for improved service delivery.
Mradi ya ushirika ya World Vision walikuja na miradi inaitwa ENRICH ya kuangalia mambo na hadhi kabisa. Wakafunza wale ambao ni walimu wataenda kufunza. Nikapatikana nikawa mmoja ya kwenda kufunzwa ili kwamba nipate kuwa tena mwalimu ya kwenda kufunza wale ambao wanafaa kufunzwa. Na ni kitu nzuri sana, na ni mimi peke yangu nikapatikana kama mama ya kufunza wase.
Tuko na kikundi ambacho tunaongozwa na Madam Christine, na hiyo kikundi ni ya men care. Gasi ya men care ni vile tu tulifunzwa kwamba tushare roles na majukumu kwa nyumbani, isiwe tu ile ya samana ambayo tulikuwa kuna vitu zingine ilikuwa tabu kufanya yenye labda mama anafanya, na sisi wanaume tulikuwa tumesema hiyo ni tabu, tuwezefanya hiyo. Lakini vile men care ilipoingia tukafunzwa kwamba kuna some things ambazo we are supposed to share na mama. Kwa mfano, wakati mama ako mjamzito tunaandamana naye mpaka kwa facility, niwe na yeye akideliver, then turudi na yeye. Mimi ndiye namsaidia nikimpepesha mtoto. Sasa wakati tulianza watu wanasema sijui mzee fulani amekaliwa, lakini walipokuja sasa kuona hiyo familia iko inainuka, iko inaendelea vizuri, wengine wakaanza sasa kuja polepole wakiulizia, na ulipataje hii mafunzo, uliendaje? And then mimi nikawa sasa nikiwafundisha, nikiwa their role model, nikiwafundisha tuwe sasa hii maneno. Kuna vitu yenye huwa inafanyika kwa manyumba, labda saa zingine unapata watoto wako standard growth, wengine wanasaliwa, labda mlikuwa na mafurugano, kumbe hata ina affect mtoto mwenye bado angale kwa tumbo. And then saa zingine unaona mama sasa mwili inaisha, anajisumbua, lakini because huwa uko open kwake, ndio sasa ashie hiyo problem yenye yako nayo. So hiyo sasa ndio ilifanya nikawaambia moja kwa moja, mpaka sofa naona kuna wengi wameanza sasa kufuata hiyo mwenendo wangu. Tumekita misisi kabisa kwa mikutano yetu ya men care. Hata sofa tuko na mpango ya kuregister kabisa, ndio ikuwa permanently ipake pale, tuko na hiyo group
kabisa. Ninaona ya kwamba hata miradi inapotoka wase wenyewe wamepata kujisimamia, na hata saa hii wameanza kufunza wase wenzao katika boma. Hata baada ya World Vision kuondoka, wako tayari sana kuendelesha hii miradi, kama ni kufunza kuhusu na ugonjwa, kuhusu chakula, wanajifunza wakiwa vikundi mbalimbali. So hata miradi ikiondoka, they are ready to stand.
In Elgeyo Marakwet, we are losing a number of mothers, and adolescents are also part of our program, because we have what we call teenage pregnancies, which affects most of our adolescents, and we are losing a number because of early marriage and teenage pregnancy which is taking place. We want to appreciate the World Vision, the ENRICH program, assisted Elgeyo Marakwet County to see that we have a number of youth-friendly centers in the county. We want to appreciate because as a county, we don't have a standalone youth-friendly center. So with the coming up of these youth-friendly centers, we'll be able as a county to reach a number of youths in these youth-friendly clinics established, supported by World Vision.
This youth-friendly center, we call it Maple Youth Group. The main reason we started this center, it's because we wanted a place where we could be taught about life skills and youths could come and just talk about anything. You know, most of the youth are scared of bigger people. One of the major problems affecting youth is drug abuse. We have unwanted pregnancies and teenage pregnancies. So one of the main reasons we come here is to be taught about how to avoid drug use, how to avoid teenage pregnancy. Apart from us learning the skills, we're also taught how to teach others. World Vision has been sending people to teach us the skills. Apart from that, they help us in starting projects like farming projects, but most importantly, they give us this space to be the center now. They fund us to start our projects. I think starting of this facility, it has been helpful because we were like enlightened, like youth can have groups, really helpful groups where we can be taught. So if this facility couldn't be here, probably we could be in our homes doing nothing really.
These communities come with many challenges, especially economically. We have a component called the Savings for Transformation or table banking, and during these sessions, the community members are empowered on how they can be able to come together and save the little that they have. And once they put it in a pool, then this pool becomes a lot which they can be able to transform themselves or start businesses. So yes, we have had to pay attention to the economic aspect so that these groups that we are working with and the target community that we are working with also can be able to actualize the learnings that we are teaching them.
Kundi yetu inaitwa Songeta Taunet. Ilianza 2017 August. Watu nakuanga na pesa za kupeana kama loaning out kwa member. Pesa imeongezeka. Tunatarajia 800,000. Tukiangalia zaidi ile vitu yote ambazo tuko nazo kwa kikundi ni through World Vision. Kwanza kabisa ni masomo elimu. Ya pili tukapewa mbuzi hiyo ya dairy goats. Ya tatu tukapewa beehives. Ya nne tukapewa chickens, seedlings ya maharagwe. Tukapewa ya sweet potatoes na tukapewa mboga. Kulingana na maendeleo pia, members wengine wako na mashamba na wameendelea kununua. Tuko na members wenye wamenunua shamba na walichukua pesa through kikundi. Kuna watu wamechenga kama plots, wako na manyumba ya rent houses na through kikundi.
The biggest impact I can mention individually of what I have seen in this project is the fact that it has been able to impact directly on the community. And through this process, I have even been able to witness people who I am 100% sure we would not have reached if it was not for this project, including some children that were assessed and found to have very serious issues in malnutrition and have been brought and have been able to get the requisite medical care.
We are going to see children who are performing well in schools. We are going to see our children going to the universities. In the coming 15 years, we will not be having a community with malnutrition because the community have been impacted by being taught about good nutrition. So we will have a workforce that is able to compete with other parts of Kenya.
It's really encouraging to be able to see women who now are at a better place or can handle whatever challenges that they are facing in relation to maternal and child health as a result of the exposure that the project has brought at their level.
I must say, first of all, appreciate World Vision Canada for supporting this project. It has really transformed the lives of many people in Elgeyo Marakwet because first of all, we realize that this county is blessed in terms of the climatic conditions and our people can grow crops that can be used to address the nutritional situation in the county. So through the program, the community were able to be trained, especially mothers and the pregnant mothers and the young kids. So now they can take care of themselves in terms of going to health facilities for clinics, and also ensuring that they eat balanced diet. And also the farmers were encouraged to grow the orange flesh, sweet potatoes, and also the iron-rich beans. So we really appreciate the program. It has reached over 400,000 people directly and indirectly.
World Vision Kenya is immensely grateful for the generous funding by Global Affairs Canada, including the additional funds that were provided to help us support the communities in responding to COVID-19. World Vision is ready to continue working with GAC and commits to do so in a transparent and accountable way. To the Ministry of Health in Kenya, I'd like to say that World Vision is very humbled by the smooth partnership as well as the technical support received from the Ministry of Health, which has led to the success of ENRICH. We look forward to seeing continuity of results to communities through the county departments of health and agriculture to ensure sustainability of the work that has been done so far.
Good nutrition is key to the health and development of children and communities. A lack of healthy food can hinder a child's brain development, delay motor skills, and slow down physical growth.